Hello and welcome to 312, the HRP podcast. I'm Tom Simmons, and I am joined today by Shaun and Garfield. Guys, can you introduce yourselves?
Garfield Drummond here with Phoenix Global Health. I am one of the managing partners at Phoenix. We provide COVID testing solutions for the marketplace, and happy to be a part of the podcast today, gentlemen.
And I'm Shaun Malin, Principal and Regional Manager with HRP Associates. And Garfield and I have been working together over the last year, 18 months or so, helping our different clientele get access to COVID testing solutions. So thanks for having me.
Now, some of you may remember Shaun and Garfield were the guests on the very first 312 podcast, and they are back again to talk about testing kits and about the state of the field right now. So last time we talked, the idea of home testing kits for COVID was pretty fresh. Then it seemed like we were out of COVID for a little while there. And from my uninformed perspective, I just assumed that the market was going to go with it. But then, of course, we saw the huge winter surge that we're still pretty much going through. And it became very clear that COVID was not going away anytime soon. And the need for home testing kits and similar products seemed more important than ever when we think about getting back to a functional space. Now, as someone who works in this field, Garfield, what's been your perspective on that last year and the changes of it? And what did it look like for you, someone who is really in the trenches on this?
Yeah, so we had a pretty interesting year. When we think back to, let's call it the fall of 2020, talking September, October timeframe, testing was the rapid testing that's in the marketplace today was just starting to become very prevalent. The access to, the average person wasn't as great. The only individuals or groups that had access to these test kits were those that carried certain federal certifications to administer testing, or you, the individual, had to go to a testing facility, i.e. a CVS, a Walmart, an organization like that, to get tested. Since then, and I'd say Q1 of 2021, we started seeing a lot more of the rapid at-home test kits hit in the marketplace. Now, as it turned out, during the Q1 period of 2021, we also saw the initial introduction of all the vaccinations. And with that influx of vaccinations, we also started seeing a downtick in the infection levels. We had this inverse reaction or relation between access to readily available test kits that any of the three of us on this podcast right now, or anyone that might be listening to this podcast, could just go to a Walmart, a CVS, or any of those other retailers and get access to a test kit. We saw that increase, and at the same time, we saw a really steep decrease in the infection levels in the community.
Right, so we started seeing that increase in the home testing kits, which obviously dropped off with the vaccination and the corresponding drop in rates of infection. But then when did things start to change in relation to the surge that happened again in COVID cases, and what did that look like for you?
Yeah, so I think it's one of those situations where, as a society, we got pretty comfortable with where the infection rates were going. However, we weren't at the vaccination levels that we needed to be. So as we got out of the spring period of 2021, our current year, where infection levels were very low, vaccination levels weren't as great as they could have been, test kit availability was very high. I had a tremendous supply of CLIA certified test kits. Those are the kits that require, federal certifications to administer at-home test kits. Every distributor out there had ready supplies of all of those test kits. Testing was really low during the late spring and early summer timeframes. And then we went into this, early summer period where infection levels started to gradually creep up again. And that was probably because of the comfort level that society started having with the low infection rates. It's the summertime period where a lot of gatherings, right? You think about the end of the school years, you think about all of the festivities and activities that we partake in, and you look at the reduced or the not optimal level of vaccinations in the community. In some communities, it's a perfect storm, a perfect formula for the increased infection levels that we started seeing in mid-July all the way through. Basically, I'd say I haven't seen the numbers starting to taper down until about a week ago.
And what kind of pivot did you and Phoenix have to make when that change happened? Like, what were you thinking? Like, what was the game plan when vaccines were out, when people were getting them, and we saw that drop? And then how did that change for you and for Phoenix when this surge started happening again, and maybe it became like really a plausible scenario that, there might be like daily home testing required, or that might be something we would want to shoot for generally?
Yeah, so our strategy had been, as we entered the spring period, our thought process was we would go through a lull during the summer periods as far as infections are concerned, and as far as groups wanting or needing test kits. However, we did expect to see an uptick in the need for testing in the fall period when schools reopened, K through 12, as well as higher education, as there were more congregate settings that were prime settings for increased infections. And we also felt that there would be that combination of not just COVID testing, but flu testing that would enter the testing space as well. And so as we looked at what was ahead of us, and this is going back to the April-May timeframe, what do we have to think about? How should we be preparing? What guidance should we be providing the clients that we're working with and the prospects that we're working with? It was that let's start stocking up and getting ready for the fall, because we won't be completely out of this COVID period. And this was way before the prevalence of the current Delta variant that's circulating throughout the world. This was more about what do we need to do to protect ourselves and to understand infection levels when we're hopefully seeing a decrease in infections, because again, the expectation was that we would see more vaccinations and we would get a natural decrease in overall infections. So to account for that, we wanted to get more kits into the marketplace in the September-October timeframe. We wanted to introduce some of our COVID and flu A/B testing strategies, because even with a decrease in COVID infections, there's still the likelihood that, and not just likelihood, there's still the reality that flu season would be upon us. And the distinction between common flu and COVID, they're blurred lines. Like, you can't just look at someone and say you've got COVID versus you've got the flu. So having testing capabilities to identify one or the other was paramount, and it was part of what we thought would be the ideal strategy.
Yeah, so we talked a little bit about kind of what it looks like now. Can you speak more about kind of the current state of play? You're talking about, the importance of the flu testing kits with the COVID to help distinguish between the two. I'm also kind of wondering what changes the Delta variant necessitated, if it was simply a matter of more testing kits, or if there had to be actual changes to the testing kits themselves to account for it, or did that play out for what you guys were doing and working on?
Yeah, so the Delta variant, all of the kits that are on the market right now are capable of detecting the Delta variant. So it wasn't a matter of reformulating, re-engineering the products that were in the market currently. The big challenge, and this has been the challenge since, we're at the end of September right now. Since the beginning of September, the bigger challenge that we've been experiencing has been having a ready supply of inventory. What the Delta variant has done, it isn't so much in the sense that it has caused manufacturers to have to reformulate. What Delta has done is it has increased the infection levels at such a rapid pace that the manufacturers in general were a little flat-foot in how quick they were able to respond and ramp up production of test kits. You couple that with the federal government taking a very, very aggressive stance in being prepared and having access to kits so that they could distribute that through their chains. It resulted in anyone other than the federal government having a very, very difficult time acquiring inventory to distribute to the private sector and for that matter, even the public sector. That is for us, that's the impact of Delta over in the current space.
Gotcha. And are we still looking at a difficulty in acquiring testing kits out for entities that exist outside of the federal space?
Oh, absolutely. Absolutely. And, from what I'm seeing, the conversations I'm having with my supply chain, with other clients, other distributors, this isn't going to be remedied anytime soon. We're looking at, another month or two before our inventory levels are back to the levels that we can, turn orders around in, under 7 days. And that is the huge challenge in this COVID space. Situations just constantly change, and the ability to pivot to meet such these pandemic level challenges, it's extremely difficult. So, I think that, as we see infection levels decreasing, vaccination levels are fortunately increasing again. It's sort of like the perfect setup for what we experienced a year ago, where infections decrease, vaccinations increase, test kit supplies start catching up at the point that infections are at its low point, vaccinations are at its high point, test kits are at their high point, and demand for those kits are going to start waning once again. And so we need to be cognizant of all of that and prepare ourselves and not fall into the problems we fell into about a year ago or 8 months ago, where we all of a sudden just stopped testing because we thought everything was perfect.
Yeah.
And we just repeat the cycle all over again.
Yeah, I think it's interesting, Garfield. You just nailed it with all the different events that kind of came at the same time. You have people who were vaccinated, in addition to the people who didn't get vaccinated up until this point, right? Now we have a situation where people, we're having lots of conversations on whether or not they still have antibodies, right? The folks that had access to the vaccines in December and January and February, depending on their body chemistry and all that kinds of stuff. We're talking about booster shots. And so that's a different dynamic than last year as well, right? Is using these testing solutions to determine when you need to get a booster shot, as opposed to kind of, at least what we're seeing in the widespread media is kind of guessing a little bit. Is it 6 months? Is it 8 months? Is it age? You're not hearing any conversations about why don't we just test people to see when they would need the booster shot. Do you have any intel on that?
Yeah, so that becomes, it's a difficult model to apply to the real world right now. Again, thinking about this pandemic and thinking about how society, the medical community, the scientific community has been extremely quick in their response to this pandemic. When you think about, global pandemics of the past, we don't go from death rates at what they were in June of 2020 to really having the ability to squash this virus in 1 year. Like historically, it doesn't work that way. And because of that, I think we have this false sense that we should quickly have solutions that would do exactly what you said, Shaun, which is, you spit in a tube, you take a small blood sample, the average person with average capabilities, and you would quickly know that you are at 100% protection versus 75% versus 25%. And that each one of those levels has a different indicator of what your probability of reinfection or new infection would be. We're not at that point. Like, I don't know that enough time has gone by for the technology to advance so that any one of us can do that. Anyone that's listening, anyone in the community can quickly assess their level of protection. Because of how quickly we've gone in developing these vaccines, I think it creates that false sense that we should have the ability to do the other ancillary testing that would definitively say you're protected and you can keep moving on in society.
So when we look at what's currently on offer now, we talked about how the kits are still effective at finding the Delta variant, talked about ramping up manufacturing. But do the kits themselves look very different now as opposed to back when we first spoke in September of last year? Have we seen much change in what is actually offered in those kits?
Generally speaking, no. And that's a general statement. The functionality of those kits, the technology around those kits are pretty consistent with where we were a year ago. And that's not a bad thing. I think that is a positive thing because it shows that these kits were valuable products then as it is today. Okay. What we have seen is an increased number of kits that are on the market. We have seen a few additional kits because of the time it required those manufacturers to get their emergency use authorization from the FDA. We've seen more kits hit the market that has other tools available. An example of that is one of the kits that we provide, utilizes a smartphone to do the analysis. It comes with an analyzer, but it attaches to a smartphone so that you're able to get sort of a machine-read test result, and at an affordable price. So between, let's call it January of 2021 and August of 2021, what we did see in the marketplace was additional kits hit the market. Their method of analysis was pretty consistent with what was there before. We have seen a steady decrease in the price point for these kits. And so that made those kits more readily available to the general public and to any consumer, whether that's an individual or a business or any other organization, made those kits more readily available to those groups. We also saw a larger number of the at-home testing, so that you could do this from the comfort of your home and you're still getting a highly sensitive test kit that when administered in some sequence, every 2 days and that's generally how they work. You take one test day one, and then you take another test maybe within from 24 to 36 hours later. By doing it in that manner, you're increasing the effective sensitivity of those test kits. So we did see more of the at-home kits hit the market, but overall the technology remained consistent with where it was before.
Do you have any sense of the degree to which the at-home testing kits make up the share of testing results that get published?
No, I don't have that, and I don't know that there is going to be a great tool that's going to give all of that information. Mm-hmm. Just by definition, the at-home testing, usually there may be one or two or a few or handful out there that is integrated into some public report-in database so that you administer the test and it automatically pushes your result out. But the majority of those kits, it's at the discretion of the individual taking that test. There isn't a report-in requirement for those tests. So any of the large databases that you're utilizing to get test results or infection levels or, negativity, so to speak, those aren't coming from at-home testing.
Okay. So do you think is it likely that people are taking at-home testing kits, getting a positive result, staying home, weathering it, they get maybe a mild case, nothing that needs to, nothing that requires hospitalization or doctor's visit. 2 weeks later, they're better, they're back on, and then their case of COVID is never recorded or never shared or shown within basically the public record generally. And so there's kind of maybe an entire slice of people that have been infected, but that we're not seeing in kind of the publicly available data.
Okay, I'll respond to that from an anecdotal standpoint. I don't have any empirical data that I can share, partially because at-home testing doesn't require reporting of the results, whether positive or negative. But anecdotally, and this is also in guidance from the manufacturers, a positive, if someone uses an at-home test and they test positive, they are likely to seek confirmatory test. And that confirmatory test is going to be a test that's administered outside of the home at one of the traditional testing facilities, and those results are going to be reported. I'm saying that anecdotally. You would still get a record of that in the public record because of what would happen after you or I test at home, we test positive, we may run another test at home, it tests positive again. You're either going to isolate or you're going to go out and get that confirmatory test from another facility.
Gotcha. And a big part of that is that, generally speaking, the manufacturer's guidance is if you get a positive test, confirm it by getting another one administered through a healthcare professional.
Correct.
Okay, gotcha.
That's correct.
I think we're getting close to that, Tom. I think that people are going to pull off the road or something, but I mean, we're going to be dealing with this issue next year. Hopefully not to the level that the Delta variant had with us. But I mean, anecdotally, on the flip side of your question about doing an at-home test and then staying home and just kind of taking care of it all on your own without seeking medical advice. I mean, my family's used the over-the-counter tests in the last month or two with kids getting back to school. It's allergy season in the region that we live at. And not only my wife, but one of my kids have had the sniffles at some point in time. And, we acquired those tests to see if we had to adapt, right? Make changes. Is a kid going to go to school? Do we need to call for a doctor's appointment? Do we need to cancel that thing? Do we need to reach out to the families we were around, the past weekend? I think that's the space that we're really moving into. And I'm not sure how many folks are really utilizing the kits like that. I can tell you that when we had the scare with my oldest, getting online to a big box store like a Walgreens and a CVS, I mean, we couldn't find an appointment, as of 3 weeks ago. So this was during the peak, right? But we couldn't find a place to get testing. We even had an appointment with the pediatrician was days away. So in order to try to get that kind of good feeling that it wasn't COVID, us having access to those tests was key to kind of moving on with our life there, that we didn't have to make a bunch of adjustments, if that makes sense.
Yeah, absolutely.
Yeah, and that I think is certainly the direction that the market is going in, not just the market, the community is going in. It's almost like you will see in the next year to 2 years, households will stock test kits the way they stock Band-Aids, because no one is going to get to that super comfort level until the virus is 100% annihilated everywhere.
So we're looking at our expectations for the future. You really are seeing that kind of ubiquitous testing kits in the home. I mean, how far away do you think we are presently from that?
Not very. I would say within the next year, so by summer of next year,
Mm-hmm.
what we're seeing on the manufacturer side and the lessons they've learned from the past 8 months is that this isn't a temporary situation.
Mm-hmm.
That they have to maintain some production capacity for these test kits. We're seeing more manufacturers come to market with the at-home test kits. So between a larger number of manufacturers providing at-home test kits, the understanding that we're not out of the weeds and we have to maintain some production level of these kits,
Mm-hmm.
we will see more households just saying, I need, Shaun's example, where it's days, if not weeks, and getting an appointment. No one wants to have that uncertainty.
Mm.
And so, for my household is a little different. I distribute these kits, so I generally have access to them. But the typical household, they're going to say, you know what, better safe than sorry. I'm gonna, make sure that I have, 6 or 8 or 10 kits on hand at any time, and just hold on to it. They're generally going to have a 6, 9, 12-month shelf life, so we're good. That peace of mind, I think, is going to become more commonplace, or the desire for that peace of mind by having these kits on hand is going to become more commonplace.
Absolutely.
Garfield, going back to the supply and demand discussion, you had mentioned obviously the Delta variant. We touched on the concern for vaccine effectiveness waning. Let's talk a little bit about the White House's mandate of test kits and what's happening in the business communities. You have Tyson Foods, United Airlines, Delta came out in the last couple of weeks discussing or citing that unvaccinated employees would either need to get vaccinated or do some testing, or they're going to increase their insurance premium. How has that affected supply and demand in regards to what you guys have been seeing as far as orders and things of that nature?
Short term, it has certainly resulted in an increased order flow for us. I think that will continue for the short term. There is a lot of uncertainty about the mandate and how those mandates are going to be, essentially administered and managed and monitored and so on and so forth. And so there's still, with uncertainty comes delays in action. Ultimately, I think what's going to happen because of the mandates, we're going to see increased vaccinations. We're also going to see increased number of test kits being sold because companies, organizations are going to need that alternate strategy where they have unvaccinated employees. That will, I think, taper off a little bit, but the need to test is going to be constant. It may not be at the current testing levels, right? Where there is a tremendous amount of testing capacity out there right now, not just in the professional labs, but what you will see in the at-home environments. I'm saying we'll see because we are really we're going through a period, and I think it'll last for another 2-3 weeks of the demand is so high that the supplies aren't keeping up with the demand for the at-home testing world. But that will get into equilibrium in the near term.
So obviously, without divulging names of companies and stuff, what do those clients of yours look like? Are they government clients? Are they manufacturing? Like, is it the whole gamut? Obviously, those are entities, associations, companies that are trying to comply or get ahead of the mandate, regardless of the questions about how it's going to be implemented?
Yeah, so we're seeing it across all the segments that we sell to. We're seeing it healthcare organizations that are administering testing. We're seeing it in K through 12 institutions that want to have some testing capability. Some of these K through 12, they carry the CLIA waive certification, so they can administer those types of tests. They are also looking for at-home kits so that they can deploy other strategies for testing in their environments. That being sending kits home with teachers or school administrators, so on and so forth. We're seeing testing on the manufacturing side. So again, across every segment, every sector of our client base, we're seeing increased activity from where we were 3 or 4 months ago.
And then I guess last question for me is, I had contact with an individual who had access to their state's supply of the Abbott kits. And the question is that they heard from the state that their supply was out. And so they were kind of they had comfort with the program that they had implemented, and they were having the testing solutions provided by the state, which was provided to that state from the federal government. So there seems to be a shift in that a little bit as the supply kind of dries up on that specific avenue for acquiring tests. It seems like folks are kind of left in the lurch a little bit to reach out to find their own testing solutions if they want to continue those programs.
Yes, and that is absolutely part of the increase in activity that we've seen. We've had new clients come on board that were previously acquiring their test kits from their local health organizations. There's no capacity, there's no inventory along those lines, so they have to seek it out via other parties. So the need to test, the requirement to test has forced a lot of organizations to get kits by any means necessary, where they were getting them at no cost because of certain federal programs. There's just no inventory, and so it certainly impacted our business in that we're getting requests where we previously hadn't gotten those requests.
All right, good conversation, Shaun, Garfield. I am sure we will be meeting up again to revisit this topic as the circumstances change and the situation changes with COVID as we continue to go through. So thanks for joining us.
Shaun, Tom, thank you for having me. Appreciate the opportunity.
Absolutely.
Good talking to you all.
Thanks, guys.
All right. Thank you, everybody.